Hi, I'm Adam Thacker, President and CEO of Good Samaritan, and this is Good Samaritan Spotlight, your questions answered. All right, question 1. Why do I receive a survey after my hospital stay? You receive a survey so that we can get your feedback on your stay at Good Samaritan. We want to know what your experiences were outside of just the clinical aspects of the care being delivered. This helps us to improve. It helps us to celebrate our team when they've went above and beyond and done great work. It also helps us to identify if there are areas of opportunity that we need to focus on and make improvements. Question 2. Who gets selected to receive a patient experience survey? Well, not every patient that is discharged from Good Samaritan will receive a survey. It is randomly selected as to the patients that receive a survey. This is actually dictated by CMS, the federal government, as a standardization across all hospitals in the country. Patients being discharged home are eligible to receive a survey and then randomly selected as to who will be surveyed at that point. We use an independent third-party company called NRC that helps us to survey patients. So the surveys will show up from Good Samaritan, but it is a third party that administers the surveys, and they are credentialed and verified with the federal government to be able to provide those surveys. Are my survey responses anonymous, or will the hospital know how I answered? So on the survey, there is the opportunity to put your name if you would like follow-up from the comments that you leave. But we also have your answers regardless if you leave your name or not. So some surveys are anonymous. All surveys are confidential. Other surveys, if you leave your information to be contacted, then we may contact you for follow-up depending on the feedback that you leave. If there's something that we need more information to clarify, or if there is information that we would be able to get from you. What happens to my feedback after I complete the survey? So your feedback comes back to Good Samaritan through a portal on the internet that we are able to review trends and align that with other surveys that we're getting feedback to see if there are certain areas that we need to focus on. Your feedback also goes back to the leaders of those areas where your inpatient stay was. So if you stayed on our 3rd floor, then the leaders of the 3rd floor will get that information, and they're able to then tie that back to the care that was delivered during your stay. Can patient feedback really lead to changes at the hospital? Absolutely. This is one of the most critical ways that we are able to improve. Your feedback leads to changes in how we communicate, leads to changes in how we deliver care, leads to changes in how responsive we are, changes to discharge instructions to help you as a patient whenever you're leaving Good Samaritan and transitioning to home. We have used feedback to change our meals and what we're providing in that regard. So feedback is extremely important, and it's one of the only ways that we know to address things is when we get your feedback. What is HCAHPS and why is it important? So HCAHPS stands for Hospital Consumer Assessment of Healthcare Providers and Systems. It is absolutely a mouthful. What it is a nationally standardized survey that all hospitals across the country are required to administer to patients for feedback. So you can be assured that whether you are Good Samaritan or another hospital, the survey that comes after a hospitalization is standardized. That allows us to compare to other hospitals, to get feedback to other hospitals in the same regard, and making sure that feedback is standardized. It is only eligible for patients who have been admitted to the hospital, to Good Samaritan, and have left Good Samaritan and discharged to home. So patients that go to another hospital or to a nursing home are not eligible. These are patients that leave Good Samaritan, go home, and then you receive a standard survey called HCAHPS that all hospitals across the country utilize. Why do hospitals pay so much attention to patient experience scores? Quite frankly, it is because we care. We pay attention to them because the feedback is coming from our patients, and we are in the business of taking care of patients. That is why we are here every day, and this helps us to continue to celebrate the things that we're doing really well and continue to focus on where we need to improve. I would also mention that these scores are publicly shared on the internet, and all hospitals are able to see those for other hospitals in a de-identified format. So there is comparison to this, and there are some payment methodologies from the federal government that tie back to patient experience. But far and away, the most important reason for why we pay attention to them is because you are our patients, and it's what's important to us is providing care beyond just the clinical care. This is the voice that you have as to your experience, and we learn from it. Every survey that we get back is looked at. I've heard only 9s and 10s count positively. Why is that, and how does the scoring work? So we utilize what's called a top box scoring methodology. This is nationally dictated, not something that we selected, but on a 0 to 10 scale of the overall rating of a hospital, the 9s and 10s are what are called the top box score. And those are the scores that are looked at in comparison to other hospitals. Those are scores that are looked at from a federal government standpoint, from a payment standpoint that I mentioned. It doesn't mean that 0 to 8 is bad. It doesn't mean that 0 to 8 doesn't count. We look at all surveys. But when we're trending against other hospitals within the region, when we're looking at other hospitals across the nation, the 9s and 10s are the scores that count towards what is called the top box scoring methodology. Besides medical care, what factors most influence a patient's survey responses? Communication. Communication is far and away the most important factor outside of the clinical care. You as patients choose to come to Good Samaritan because you have trust in the clinical care that you are going to be delivered. Our focus is not only to deliver excellent, high quality clinical care, but to deliver that with compassion, with respect, with clear communication that sets you up as a patient to be successful when you leave Good Samaritan and go back home. So besides medical care, we are asking questions about how responsive our staff was to your needs, how the food tastes. We are asking about pain management. We are asking about how well our doctors and nurses communicate, how well our whole team communicates. We're asking questions about discharge instruction. And so you have a clear plan for discharge from Good Samaritan. Those factors all impact the all-inclusive medical care that's being delivered. What's the most important thing you'd like patients to know before they complete a survey? Your feedback matters. Your voice matters. We absolutely review every survey that comes back in and the comments that are left, because that is how we improve. We have a team dedicated to patient experience, and all of our leaders, all of our staff across the organization understand the importance of providing not just great clinical care, but a great experience for our patients. And that is not just if the experience is happy from a clinical one, but that is the experience no matter what the outcome is for our patients. We're going to provide that care with respect and dignity, no matter your journey in healthcare. This feedback helps us to improve. The surveys are really important to us. I'm Adam Thacker, President and CEO of Good Samaritan, and this has been Good Samaritan Spotlight.